Philadelphia, this is Good Day.
Okay, women of color can't get laser hair removal. We've talked about that on our show. Till now, yeah, there's a new laser machine. So listen, fellas, you also need to watch this. Miss Pennsylvania and a Sixers dancer are going to do the demo. Leg hair removal. With
they volunteered.
Laser. Yes, they did.
Did you?
Well, did they really volunteer, or
did you just make them do this?
Well, I saw her at the game the other night, the Sixer game. Says, could you help us with this? So she's coming in.
And I'm sure she felt obligated to say yes to you.
I'll do it.
Sure. She's got to get her hair removed, for the Delaware Valley to see.
It's just their legs. I mean, it's nothing crazy.
Right.
All right, here's Sue.
Yeah, and there's been a flurry of hair removal and pedicure activity since we got warm out.
Yeah. Well, let's get to Jen because she has 3 very interesting segments today.
I have very interesting stuff. Dr. Bernstein is back. We love him. Here's what we're going to do. Everyone's taking off their clothes now, aren't they? And they're pasty, they're white, they're hairy, and they have rosacea. But you're going to tell us how to fix all of it.
Yes, I'm glad you said they and not me.
Not him. So coming up after the break, we're going to talk pros and cons of rosacea and laser hair removal. Spring is in. We got to get ready.
There's no pros to rosacea.
There's no pros. That's right. We're going to talk about the cons. We'll be right back.
All right, I had no idea so many people were dealing with this rosacea issue with your skin.
Yeah, and spring is here, so, people are showing their skin.
Right.
They're a little bit, and rosacea, those red veins, sometimes you see it on their face and their skin. And they're also booking laser hair removal treatment. That's another big thing.
That's a big deal now.
Yeah.
Here's Jen with all that stuff.
We are at the home of all lasers. This is like Laser Palooza here with Dr. Eric Bernstein. Good morning to you.
Good morning.
Okay, so I called you a couple weeks ago. I said, what are people talking about? You said rosacea is the #1 thing. Before we get there, though, we're going to do some, by we I mean you are going to do some amazing laser hair removal. We have some befores and afters. This gentleman, look at the before. He was extra super duper hairy, and then the after is so dramatic. How long did that take?
Back then it probably took 2 hours. Now it probably takes half an hour, 15 minutes to half an hour.
Oh, the new thing that we're going to do in the 9 o'clock hour is you're going to do laser hair removal on a person who has dark skin.
Yes.
Why is that so new, and what do people need to know about that?
The reason that's difficult is the laser can get confused and hurt the skin instead of hurting the hair. So you need a special type of laser. It's called a neodymium YAG laser to treat darker skin types. It's very important.
Okay. So we're going to do that in the 9 o'clock hour.
Yes.
So in the 8 o'clock hour, we have our patient here, who, by the way, she's a big-time Good Day viewer, so thank you for doing this for me. Rosacea is triggered by everything that everyone loves. Hot weather, alcohol, spicy food, correct?
Caffeine, exercise, sure. Doctors tell people avoid the triggers. It's like lock yourself in a room. It's ridiculous advice. The only thing that really treats the cause of rosacea, the extra veins, is laser. And the way to prevent them is sun protection.
Okay, so we have a before and after. It looks like a woman. She has a lot of red stuff in her face.
Yes.
Again, is the after one treatment?
That's after 2.
Okay. And what do people need to know before they come into a place like this? What should they be worried about, if anything?
Well, I mean, if it's a place like this, you shouldn't be worried. You need to find out who's doing the treatment. Are they board certified, and what specialty? Do they own the lasers? How long have they been doing it? Speak to other physicians and speak to other patients.
Why is it important that they own the laser?
Well, I think if you rent a laser, if it just comes in periodically, you're not doing it a lot, and that equipment's not really set up to be moved around.
Okay.
And it's probably not being maintained by the company that made it, which is kind of important.
So once you do this and you get rid of all the stuff, if she stays out of the sun, is that enough? I mean, we can't tell her not to have alcohol and spicy food and exercise.
But that stuff only causes the veins that we've already gotten
to
fill up. So it's really about the sun, but it's not the sun people think about. Window film in your car, which we've talked about. Blocking the UV rays. Sunscreen every day, 365. If she lived underground, she'd never need another treatment. But if she lives in the real world, it depends. My parents live at the beach. It took 5 or 6 years before they need another treatment because I treated
You staffed your parents?
Of course, and myself. All 3 of us have rosacea.
Okay.
It's hereditary. 5 to 10% of the population has rosacea.
And what kinds of people suffer from it more? People who have really light skin?
You know, it's funny. It's more people that have light skin, but people that have dark skin also get rosacea. Veins that we acquire from the sun, and those veins that we acquire, they flush more quickly than other veins in our body.
That's why they look red?
In response to, alcohol, exercise, hot and cold. People talk about the flushing, feeling red. The only way to deal with that really permanently is to laser those veins away.
Okay.
We don't need them. We weren't born with them.
Okay, good. So coming up at 8:15, we're going to help our patient here. You're not nervous at all?
No, not at all.
She's, whatever. Okay, so Mike and Chanel, it was interesting because I always say to him, what's hot, what's new? And he said this time of year, everyone's worried about rosacea and everyone's trying to get rid of it. So we're going to
What are you going to do to that woman?
Veins. Are they veins?
They're veins.
Okay, good.
Yep,
That's
some you
some
can
veins.
see,
Jen, what are you going to do to that woman behind you? She's a good day viewer.
She's going to
Don't
get
hurt
her face zapped off at 8:15.
We're going to zap her face. Okay, I'll watch for that.
Yeah.
Run!
Face off.
It's 7 face off. Hockey game tonight. Here's Jen. Okay, now we've seen some laser techniques. We're going to see some more today.
Here's what we're going to do. This beautiful Good Day viewer is ready to have some of the rosacea taken care of, and this Good Day viewer is going to take care of it. Dr. B is going to help us out. We are going to see some laser live when we come back. We're not going to say zap her face.
No.
Just laser.
Live laser.
Okay, we'll be right back after the break.
Do you have blotchy skin? Rosacea is what it's called, right?
You get sometimes the little red, it's almost, little veins under the skin.
Yeah, well, a woman's volunteer. She's a Good Day viewer. We're going to laser that off.
Is that possible?
Let's find out. We're going to do it right now. Here's Jen.
It's possible. We are here. And by the way, we want to say a couple things. She'll be able to go back to work right after this, just put a little bit of makeup on top.
Right to work, yeah.
And she went to go see her dermatologist to make sure, because we say, you just said it, that sun is the #1 reason why people are getting rosacea. So you just want to make sure there's nothing more intensive than just
Everybody
rosacea.
has rosacea. Needs to get, also everyone.
Okay, so what are we going to do here? What should we be looking at?
So the first thing we're going to do is treat these little line veins, and then we go over the whole face after that. So here we go. 1, 2, 3. And you can see them disappear. I don't know if they can get that on camera, but it's totally awesome. And what's amazing is...
You're not even flinching.
Look at that. Look at them disappear. I've been doing this for 15 years. I'm still amazed. That's what makes me think probably not that smart.
So you're doing this, and what will she see like this time tomorrow?
This time tomorrow, these veins will be gone. She'll be a tiny bit pink, if at all. In the old days, it used to be bruised purple like an eggplant.
Really?
The new lasers don't do that anymore. This is my favorite laser. I have 3 of them.
And you didn't put any kind of numbing cream on her? She has not been given any kind of sedative or any kind of, like, wacky medicine to make her chill out?
Nothing. She's chill normally.
She's not even squeezing my hand that hard, I have to say.
It's startling, when your eyes are closed. I could be counting instead of talking. 1, 2, 3. So she knows when the spray is coming. There's a cool spray that protects the surface of the skin, makes it less uncomfortable. My friend in California invented that. It's a wonderful invention.
What's the average age that people start seeing this kind of issue with their skin?
For most people, it's in their 20s.
Okay.
But some people see it in their teenage years, unfortunately.
That stinks. So do you treat kids that are as young as in their teens?
I do. I do, because you know what? It becomes a source of embarrassment, and it's only going to get worse with continued sun exposure.
Now, we keep seeing like a spray. It almost looks like a zap, but that's not really a zap?
No, the spray is it's sort of the stuff that evaporates from the skin, that cools the skin right before the laser. And the laser is the orange light. All laser is, it's a light of exactly one color. But we have to make it the right pulse duration. How long that little flash stays on is a function of what kind of vessels we're treating.
I have to say, I could watch this all day.
It's awesome, isn't it?
Yeah, it is. And
I got a great job. I know you want my job.
I do want your job.
It's really cool.
And the whole face will take, what, about a half an hour?
No. It'll take 10 minutes, 5 minutes.
Really?
Yeah. We're kind of taking our time here.
She will have to come back for how many treatments?
I tell people 2 to 4, depending on the severity.
Okay.
Always 2, because the key is you really want it to be away, and I'm cheating, and then I'm wearing a light on my head that is a great invention by these guys at Harvard. This guy, Bill Farinelli, invented this light that allows me to see everything.
Okay.
All the brown spots, all the redness. So now we're going to treat the whole face for generalized redness, using a different setting and a different spot size.
Okay.
To her, it'll feel like a pinprick, but we're treating every square inch. So we switch hand pieces.
And this is one of the things that you're saying, if you didn't own this laser, if you didn't know it so well, you probably wouldn't know all the settings and all the things it could do?
Well, I mean, it helps to do, it's like anything, right?
Yeah.
Could I do your job just trying it once? No way.
Probably not. I hope
not. It's the more you do, and what's amazing to me is that I'm still fascinated by it. We've probably treated, hundreds of thousands.
And one of the other things I want to say before you get started, because we're going to wrap it up in just a minute, we all have eyeglass or eye protection on. We're in a room where you blocked out the windows. Why is that so important?
Because these lasers can be dangerous to your eye, and they're serious, so they're very, very safe. But like anything, you need to know how to use them, like a car.
Okay.
Car's safe, but it could be dangerous.
Hey, thank you so much. You're doing awesome. And Chanel and Mike, how cool is that?
That is really cool. And it's so quick.
Now, I've heard that it's like
so
snapping a rubber band against your skin about laser.
Ow.
Well, that's not horrible.
Well, that's what she said that she expected, but she said it was less than that. It was less than a rubber band being yeah. She said she was expecting it to be a little harsher, but I don't know. He's got like the hands of a baby.
Hey, Jen, I think you covered this. How much is it, each treatment?
She doesn't want to move.
The treatment cost varies, but Doc, what's the average treatment cost?
It's anywhere from $450 to $775.
There you go.
It varies.
Okay.
Okay.
Thanks, Jen. 8:20. And remember, next segment we're going to do, well, I'll tell you about it in just a second here. Hey, one of your good friends, Jenny's standing by here. Hey, Jen.
Hi. Hi, Bernie. Hey, Mike. Hi, baby. As advertised. Miss Pennsylvania. Okay, now she's got to be looking all lean and mean to make sure she gets that title of Miss USA this summer. So how is she getting ready? Well, laser hair removal, of course. So when we come back, we'll put on the dorky glasses, and we're going to have some fun. Dr. B's going to hook us up. Congratulations, Miss Pennsylvania. It's great to see you. We'll be right back.
Laser hair removal. You know, a lot of women of color can't do this because they say that it would leave a scar.
Yeah, it would discolor the skin.
Yeah. No, it apparently, though, it's kind of catching on. A lot of people are doing it. There's one doctor who says he's got the right laser and the right person to try it on.
Well, yeah, wouldn't you like to see Miss Pennsylvania have some hair removed from her legs?
Yeah, that's
seriously,
something.
Jen.
As you eat your breakfast this morning.
I can't believe we got her on.
Okay, this doesn't happen all the time. Number one, you don't always have a beauty queen in the 9 o'clock hour of Good Day. And she is a queen. She is our queen, Miss Pennsylvania. But she doesn't have her tiara on because today we're doing something serious. Dr. Eric Bernstein, good morning.
Good morning.
How are you? Okay, so explain to us why laser hair removal isn't always the best option for people of color and why this thing is going to work out perfectly for her.
Well, I think it is the best option as long, especially if you're treating a big area.
Okay.
It's pretty much your only option.
But why did people in the past, why couldn't they do it?
Because what we want to do is have the laser see the little hair that's in there without seeing the skin.
Okay.
And the older lasers would hurt the skin, but now we have lasers that are longer wavelength called a neodymium YAG laser that can ignore the pigment in the skin and treat the hair, but it does require knowledge. You have to pick the right energy, right machine. It's much harder.
Okay, so we're going to bring in the lovely and talented, and or are you going to actually do it?
Lisa.
Lisa, get over here. Lisa's reluctant to be on camera because she looks so fabulous this morning. And so you are getting ready. You can just nod. You're getting ready to be Miss USA pretty much, right?
Right.
That doesn't get in the way of any superstitions.
No.
Okay, good. So she's going to be Miss USA, and we know that we are now a part of the process. Not really, but it's fun anyway. How many treatments will she need on the leg?
Usually we do like two to four treatments at 2-month intervals, and then the interval gets longer.
And the goal is eventually she will not have to shave
The goal is to never shave. Maybe you come in once a year, once every year and a half, and that's it.
For the rest of your life.
That's it, yeah.
Woohoo, baby! The rest of your life. No more shave. Okay, so what is she doing there?
So she's getting the laser ready. She's calibrating it, which means picking the right energy.
Okay.
And now she's ready to go.
All right.
And you can see it's a big spot. It's fast. Laser hair removal's fast.
And why do they have the white lines on her skin?
So we know where we're going and where we've been. When you're treating a big area, you need to know. And the reason they're white is you don't want the line to take up the laser energy. If you made them in black, they would take up the light, and that would be bad.
Okay, and Jessica's working behind her. What is she doing?
She's using a smoke evacuator because you're actually kind of vaporizing a little hair. It creates a little inflammatory response that tells that hair to go into a resting phase where it gets really tiny.
Will her leg get bumpy or red after this?
There will be little bumps around every little hair. And that lasts for like a day or so.
Okay.
And then the hair just kind of disappears. It either falls out now or it falls out over the next 7 to 10 days.
Because I know Mike Jarek will ask me, what's the average price for something like this?
Depends on the area. So like, you know, from 100 something for the lip or small area up to $800 to treat a leg, but it varies across the country.
So you can do hair on someone's face?
Of course, but not around the eyes.
So you can't do like eyebrows?
You don't want to do eyebrows or unibrow with a laser, definitely not.
But you do chins and
chins, lips, jawlines, absolutely.
Do guys ever come in to get their hair off their face so they don't have to shave?
Well, guys come in when they get the shaving bumps like me.
Okay.
I had bad shaving bumps, and so I had laser hair removal on my neck. And I probably get it done once every 1.5 to 2 years.
Okay. If Miss Pennsylvania looks familiar to anyone, it's because she used to be a Sixers dancer, which we love. And I promised you could have 2 seconds to talk about your beloved Sixers. 1, 2, 3, here you go.
She's from Miami.
Right.
We got mugged during a tournament. I heard the commissioner was down there. I saw him do nothing about it. Miami shot 1.7, almost twice as many foul shots as we did. They made 25 more foul shots than we took, and we were getting mugged the whole time. The superstar effect, I can't stand it.
Okay.
They should be forced to play like superstars.
I love it. You feel no pain right now?
I feel no pain. I'm excited. I'm getting swimsuit ready.
Swimsuit ready. All right.
And I'm from Philadelphia.
Yeah, she's from Philadelphia, not Miami. She lived there for 5 minutes.
She used to live there, but she's a Sixer fan all the way.
There we go. Okay, Mike Jarek. I know this isn't exactly how you wanted to be introduced to Miss Pennsylvania, but nonetheless, you have been introduced to her. Could she be any cuter? Sorry.
Yeah. She could be cute like this.
I mean, if you can be this cute while you're getting your hair taken off, can you imagine how cute you are like on a Friday night?
No. Miss Pennsylvania, middle part of June, it goes into she competes in the Miss America pageant.
Miss America.
And I think she's going to win it.
Miss USA.
Is it Miss USA?
Like I said, Miss USA. That's exactly what I meant.
I'm going with her. I'm just kidding. Can I go with you?
It's Miss USA.
Okay,
Miss America's in September, I guess. Thank you, Jen. 9:27.
Okay.
Okay.